wikidartist.com.
Dental implants are a perfect replacement for your lost natural teeth. Why dental implants? Most of the time dental implants are done where you cannot have bridges, or you want to put a tooth there and you do it and it is fixed onto the bone. Now when I say that it is fixed onto the bone, we actually make a hole on the bone and then we put the screw onto the bone. It's not like bone is a living thing. So what happens is we want the bone to survive, because as you know, our bones are going continuous remodeling. Every 6 months you get a new bone, actually speaking. Why? Almost every bone is slowly changing, because there is a lot of osteoclastic activity and osteoblastic activity. Osteoblastic means the bone is formed, osteoclast means bone is removed. So just because of that only, even if you break a bone, most of the time you fall down, you break a bone, what happens is there is a lot of osteoblastic activity. That is why it gets healed. And there is a lot of osteoclastic activity that you can see. If you remove a tooth and if you see the person who has not lost all the teeth, they will not have much bone in the mouth. So that means that there is bone which is removed also. So why you do an implant is itself to preserve the bone, because when you have pressure on the tooth, then what happens is the bone survives. So the most important things to be done is actually to do a proper bone management. What is a bone management? There are do's and don'ts, especially nicotine. Nicotine is as you know that it is a highly irritant stuff. Okay, it's good. It's most of the people who smoke, they love it, but it's actually because of the irritation which is caused all through the body. They like it because they like that little bit of sensation. So what happens is, even for the bone it is bad. So what happens is the bone will go off. So around the implant, if there is a lot of nicotine deposits, as you know, if you can take a puff of smoke and then you can puff it onto a white cloth, you can see how much of nicotine is there. So once the nicotine gets coated onto the implants, what happens? The bone moves out of the area. So what you should do is, if possible, stop smoking. And if you are doing an implant, I think that you should definitely stop smoking. Now second thing is, you should not have calculus. Your tooth got lost because of calculus. You have plaque, you have calculus, and then only the tooth went. Now you are putting an implant, you are expecting it to stay. It is not at all on wood or a metal piece or a concrete. It is actually your own bone. So I want you to keep the bone there. So if you want the bone to be there, just because it is not natural doesn't mean that the bone will still be there. The bone still can go. So around the tooth or around the implant also there is natural bone which is there. So I want you to preserve the bone. So what all you have to do, you should control your diabetes. If you have infections, please control it. No plaques, please make sure that you have no osteoporotic activity which is happening, especially for females who are above some age. What happens is there is a lot of osteoporotic activity, or the bone gets weighed off. That is why they have problems with their knees, problem with their joints and all those things. So if there is a lot of osteoporotic activity, you have to stop that also. Otherwise the bone will be weak and then the implant also might fail. So all these things, the general things are that. Then especially your hygiene should be pakka. You should have a proper hygiene. Just you lost your teeth because you didn't keep your hygiene proper. Now you have an implant. It is not better than what God gave. We are only giving actually something which is given to you just because you have lost what is God given or nature given. So it's not better than nature. So it's an artificial thing, but it is just like your kidney which is kept. You know that how much care is taken after a kidney transplant or a liver transplant or a heart transplant or whatever transplants you do. Most of the people do take a care. Just like that, implants also need care. Not up to that mark, but still it requires care so that it survives a lot of time. So make sure that when you do an implant, you get committed. It's just like you buy a car. You have a car, you bought the car, you will drive the car, but you should also make sure that it has a proper and regular service. Go to the dentist, get it checked. If there is any problems, we have to correct it. If at all you are doing something wrong, he'll tell you this has to be stopped, this has to be this things has to be done. And if you have multiple implants, I'll advise you to have an electric brush, that's like a rotary brush, and also a water pick. Why water pick? Is because you can actually floss between all the implants using the water jet, and it also will massage your gums so that there will be a lot of blood circulation, and then the blood circulation will help the bone to survive. So all these things will help your implant to be there for quite some time. There are a lot of people who are living with implants for 25-30 years, but there are people who lose the implant within a year or two. So make sure that you do a proper follow up and also a proper hygiene practice for having an implant which will actually survive and also give you a better smile and a better bite. Thank you very much. I am Dr. Thomas. Please make sure that you send your comments. You can actually ask me questions through this channel. Keep subscribing Wikidontist, and also send it to all your friends so that it will be helpful for you. Thank you very much. I am Dr. Thomas.
Wikidontist.com